Okay, in the previous video, we have talked about the STAR method. Now, that was in situations of like ethical dilemmas, in role play situations, and all. We can use that STAR method. Now, there is another method which is called the Spikes framework. Spikes framework is for delivering difficult news or breaking the bad news, because that becomes a difficult situation in all of our medical profession. We can manage the patient, but to effectively communicate, especially the bad news, it becomes a challenge. So this framework will help not only in MMI but also in our real life situations. So we'll talk about the Spikes framework now. So Spikes is like a structured approach which is used to break the bad news in a compassionate and a professional way, because you don't have to be too much of on the sorry side. You have to make your make a firm stand, and then effectively communicate also in an empathetic and compassionate tone. So we'll see what Spikes actually stands for. So S in Spikes stands for setting, P for perception, I for invitation, K for knowledge, E for emotion and empathy, and S for strategy and summary. We'll see it with an example. So suppose we have to tell a patient about their diagnosis or about a cancer diagnosis. Okay, so we'll analyze the situation what in the Spikes format. Okay, so you have to first ensure that the setting is a private and quiet place. There are no distractions. You can set an eye level and use open body language. You can take them to a separate room. You can ask who they want along with them, like if they want their son to be with them, to their family member along with them, because you don't have to break that bad news to the patient alone, because it can be stressful. So we'll analyze the situation. So you can say, Mr. Smith, it's an imaginary name. So Mr. Smith, let's move to a quieter room where we can talk privately. Please take a seat. Is there anyone you'd like to have with you? So that you have communicated you have made them calm. You've asked them if they need somebody along with them. Now P is perception. Spikes, the P is perception. Perception means asking what the patient already know, because some patient might be truly clueless, totally clueless about anything that is happening around. You might have taken a test, because if you're coming out with a cancer diagnosis, you must have done different diagnostic tests, but they might have no clue regarding the process that is done to them or their diagnosis. So you have to understand what they already know and gauge their understanding of the situation. For example, you can ask, before I explain the result, can you tell me what you understand about the test we did last week, or the investigations we had done, or the diagnostic workup we had done? You don't have to use medical jargon. Also, you have to use understandable language to them. I is invitation, which means now that you have understood what they know already, you are inviting them to know more. You are asking how much do they want to hear, because some people only prefer basic information while others want everything in detail. So you can ask, would you like me to go into full detail, or would you prefer a simpler explanation? Okay, that is invitation. K is knowledge. Knowledge means you are sharing the news in a clear and simple language. You have to always avoid medical jargon, deliver in small chunks, and pause to check their understanding. You don't have to go in like a full 10-mark essay and then they'll be like perplexed. You don't have to put them in that situation. You have to go small, better, you can start. Okay, so we have done this test last week, and the test has come out to be a little bit questionable. So we have done further diagnostic test. With all that thing, we've come to a conclusion that you are having this disease, especially after the perception and after the invitation. If they don't want to hear the full thing, you just can tell them what their final diagnosis is and what your next steps are. So you can say like the test results show that you have early stage colon cancer, but the good news is we have effective treatment options available. So you are making clear and effective communication with also an open thing like, okay, there is hope, there is next steps to be done. Okay, that is knowledge. Next thing being emotions and empathy, which means you're acknowledging their emotions and responding with empathy. You can say that I understand this must be difficult for you in this situation, but you don't have to be sorry. You can't say that, okay, I'm sorry, because that doesn't imply anything. So you can say like, I can see this is very upsetting for you. It's completely understandable, but we are here to support you through this. Okay, or you can say that your family is there with you, things will get better, we'll get through this. Okay, you can put in hope, but not false hope, because that is also a bad situation. If they are like a stage for cancer, there is no probable cure, you can put that in a very calm and empathetic tone as possible, because you can't like simply say, okay, we'll do some treatment and get through this. If there is no hope, you don't have to put false hope also. S means strategy and summary, like what is the next step in action, what is the next plan of action, and you have to ensure that they understand what happens next, because they don't have to be, because all of that diagnosis might not get into head. They want practical solutions to their problem. So you want to maximize this understanding of their the next step, the plan of action. So you can say that our next step is to schedule a consultation with an oncologist to discuss your further treatment options. So would you like me to go over those now? Like, you don't have to put in everything on their plate all together, because they might it can be too overwhelming. So that is your spike strategy. So we'll go through that once again. So suppose you are having a patient who is having a cancer diagnosis, and you are going to break that news for them. So first you have to set a private space. You can say, okay, now you can come to me to the room, you can take your seat. If you want, you can call somebody along with you. It is better when you are breaking the bad news, it is better it is not done directly to the patient alone, because it can be so overwhelming and stressful at that point. Next, you try to understand what they already know. So what is your understanding of the tests that we have done last week, and how much information do you want to know? And then you break down in clear, understandable small chunks, and giving posts so that it take time to take it in. And then you empathize with them, but also summarize and strategize, and explain to them what is the next plan of action. So this was the spikes method. We have already discussed star method. We'll summarize it today. What is star method? Star method is for structural responses, like based on your teamwork, leadership, conflict resolution, ethical dilemmas, all of that thing, you can use the star method. So it is situation, task, action, result, and reflection. Okay, so that is it. So we'll see more videos on MMI in the coming days. Thank you so much.